Welcome. Welcome to Strengthening the Core, a team-based approach to clinician engagement. I'm thrilled to introduce my co-panelists here in today's session. First, Dr. Matthews, looking forward to having him join the discussion today. He's an orthopedic surgeon and currently the medical director of development for Medstar Health. Dr. Matthews previously served as chief orthopedics at Medstar Union Memorial Hospital and the regional director of orthopedics for Medstar Health. He's an active member and leader in several medical professional societies and consults with many innovators in orthopedics. His background is in sports medicine with training at Johns Hopkins and Massachusetts General. Today at Medstar, Dr. Matthews is focused on supporting and enhancing the gratitude model that has become the cornerstone of philanthropy at Medstar, establishing an enduring culture of gratitude through the organization that supports patients as well as caregivers. This is his current focus of his professional efforts. In addition, Leah Murray is joining us today. Leah is the Director of Philanthropy Education at Medstar Health, where she partners with providers and associates across the system to grow a culture of gratitude. She's nicknamed the Gratitude Evangelist, and she develops strategies, strategic educational programs, materials, tools, so that all of the clinical teams at Medstar recognize the value of patient and family gratitude, importance of response to gratitude, as well as how and when it's appropriate to connect with the philanthropy team. She began her role at Medstar Health 4 years ago with an operational focus as the manager of the Grateful Patient Program. And before joining Medstar, she was part of the philanthropy team for basic sciences, cell engineering, and genetic medicine at Johns Hopkins School of Medicine, as well as having a role in physician marketing at Mercy Medical Center in Baltimore City. And third on our panel, and the leader of the Medstar Philanthropy Group, is Bruce Bartoo, Senior Vice President and Chief Philanthropy Officer for Medstar Health. Medstar Health is a 10-hospital system with hospitals in the District of Columbia, Maryland. Bruce is responsible for all initiatives to enhance philanthropic partnerships with Medstar Health, and he leads a group of 50 professionals through the Medstar Philanthropy Group. Prior to joining Medstar, Bruce served in St. Louis at the Mercy Health System as the Chief Philanthropy Officer and the Foundation President. He has a diverse set of experiences in professional philanthropic roles in healthcare, higher education, and politics. He's a CFRE and has a Master's of Public Administration from Drake and a BA from Westminster College. And I'm thrilled to join our panel. My name is Ben Golding. I'm the President and CEO of Advancement Resources, partners with Medstar Health in the work we're going to be discussing today. And I look forward to turning it over to my partner, Leah, who is going to outline for us what our plan for the day is.
Thank you, Ben. So we're so glad to be here with everyone today and share a little bit about our work with you. So what are we going to cover? We're going to talk about gratitude and why it does matter and how it matters. Second, we're going to talk about our engagement through education and how we formalize that through the Medstar Philanthropy Academy. Third, we're going to talk about observations in patient and family gratitude in our current environment and how we see that with our direct patients and families and also our broader community. And then we'll have time to spend with you all to be able to have a discussion about the content we deliver today. So first, I want to start with a quote. Feeling gratitude and not expressing it is like wrapping a gift and not receiving and not giving it. So we want to think about that as all of the interactions that we have with our patients, families, community members. It truly is a gift in that expression, and it needs to be treated like that. So Bruce has given us a great phrase that we use all the time called gratitude matters. So gratitude matters at Medstar Health, and not just here, but everywhere else. So let's jump right into our first section. So before we start talking about our clinician education and the academy and our contemporary observations, we need to establish significance of gratitude because it's central to all that we do and drives how we work. So gratitude drives meaningful philanthropy. And our experience and what we believe is that gratitude comes from a personal, deep desire to show love to others and will be expressed in a meaningful way that is unique to the individual. And we see that day in and day out. And we'll talk a little bit more today about how we recognize that and how this is central to all that we do. This definition of philanthropy, many of us have much other ways that we define that, but the actual definition is the love of humankind. And Bruce, I'm wondering if you can share a little bit about why that definition is so important to us and how our experience really shapes how our team operates.
Thank you, Leah. Look forward to this conversation and interacting with our colleagues. And Ben, thank you for hosting us today. And Dr. Matthews, special thank you for for being part of our team and for participating in this important session. So it is true, and I think this definition of the Greek word philanthropy is one that we should all always keep in the back of our minds. It's not about the love of money, it's about the love of humankind. Everyone thinks of philanthropy just in a financial sense, but the word truly defined is love of humankind. And many families choose to express their love for humankind through a philanthropic or financial investment in causes that are important to them. And we know this well in healthcare. Our most significant philanthropic partners are partners who are grateful and they want to share their love for the teams that took care of them or their loved one. And not based on outcomes, sometimes it's a suboptimal outcome, but that family member had a fantastic experience and the family is exceptionally grateful to the caregiving team. And so they choose to express gratitude. That gratitude is actually philanthropy. It's their expression of love of humankind for the work that was done to help their loved one. And so we know that the single greatest motivator for philanthropic investments in healthcare comes from gratitude. So this notion of gratitude driving meaningful philanthropy, you can't separate those two things. They're critically important. And Leah, to your point, we say this, we've trademarked it at Medstar, gratitude matters. It matters to families and patients who want to express gratitude. It matters to the care teams who receive that gratitude, and their work is therefore validated. And so the work we do in healthcare philanthropy is not just about the money. It's about a connection to patients and families and care teams and our responsibility to facilitate the love of humankind across both of those sets of people.
So next we're going.
I'm sorry, Leah, I was going to just say the best way to reference this and share an example, I think you were going to tee this up, Leah, is the next video, which we're going to share from you, which is purely about philanthropy, the love of humankind, and gratitude related to care experiences. Let's take a look.
I have Parkinson's disease. Dr. Fernando Pagan changed my life. We've been very pleased with the doctors, needless to say.
Yeah, we've had a lot of great success there. They have some great talent at this hospital, at Georgetown Hospital. When you live in a community like this and you've been blessed and you can give back and help others, there's a different feeling between just supporting so many wonderful causes that we support in the arts and other arenas in education. But this feeling was even more special because it's our way of saying thank you and showing our appreciation. It just feels good. It feels good.
When it affects your family, it's a different feeling. We give to other causes, such as the Kennedy Center, where we're very active, because we believe in it, and we believe in the arts. But inside yourself, you just have a feeling of gratitude, really.
It's important to give back, and it's our way of showing our appreciation, because they're amazing. When I think of the success that we've had through their efforts, and you know, it's an opportunity to help others. And so that's why we decided to make a major family gift to the hospital.
At Medstar Health, our work, in fact, our mission, is to create a culture throughout the organization that empowers our providers to recognize, receive, share, and celebrate gratitude. The power of gratitude is undeniable, and it reaches well beyond philanthropy. Research has clearly demonstrated that a gratitude-based culture will increase patient satisfaction, increase HCAHPS scores, reduce provider burnout, increase physician engagement, and generally improve well-being.
So that really drives and sets the stage for why our engagement with our providers is so crucial. It's because the benefits of philanthropy and gratitude specifically extends beyond any dollars that come through. So let's talk about how we've really formalized that and shared that message with our team here at Medstar Health. So we essentially took all of the presentations and things that we do to engage our providers. And when I talk about providers, I'm not just talking about physicians, but we're also talking a little bit of a broader audience. And we're talking about nurses, PAs, everybody. So, and we'll talk about how the Academy kind of addresses those different audiences and what other groups are involved in that. But I just want to establish that providers is a broad term that we're using. So our goals for the Academy is to grow a culture of gratitude through Medstar Health, enhance the career development and skills of our internal team to implement our model, increase engagement and understanding from care providers to embrace the value of gratitude, and creating a more natural pathway for philanthropic partners. So let's talk about who our audience really is. So first is our philanthropy team. So when we started with our really engagement model and education and working with our care providers, we have to be prepared as a team to make sure we're all aligned. Not only are we thinking about things in a similar way and we're united, Bruce always talks about us being one team and one Medstar, and that's something we really try to embrace. Our providers are continually moving throughout our system. So our hospitals are spread between DC and Baltimore. There's 10 hospitals. And in a lot of instances, those providers go from hospital to hospital and have multiple offices. We need to make sure as a philanthropy team that we are working cohesively to make sure no matter who we interact with, that our providers are having the same experience with the philanthropy team, no matter what hospital they walk into. So we have to make sure our team is educated first and we're all working the same way. Second is our care providers, engaging with them, with, just like I said, nurses, physicians, PAs, everybody, techs, therapy is huge, social work, large base there, whoever is patient facing. Medstar associates, so that's everybody else. We want to make sure if we are developing a culture and gratitude, we can experience all those benefits at Medstar and within the hospital walls. We need to make sure it doesn't just stop with our care team, but that everyone in the office is aligned, from when you meet the security guard to who comes into your room to patient advocacy, billing, everybody. We don't leave anybody out of our education or talk. We'll take the opportunity to talk to anybody that will have us. And then lastly, board members. And think about this as board members and volunteers. So this extends, this is our Medstar board, our philanthropy committee board members, and then broader volunteers, right? So those that interact with us regularly, that help and join the mission of Medstar or our specific entity in by getting us involved with the community. And that can look a lot of different ways, even auxiliary or something like that. So how do we really interact with these groups? First, our philanthropy team. I'll go over these tools briefly, and then I'll really hand this off to you, Bruce, to talk a little bit more of the strategy kind of behind that and why this investment in our internal education for the team was so important. But we developed a variety of ways for our team to be able to interact and grow. So first is e-learnings. Not only through our system e-learnings, where you would take your HIPAA training and everything like that in the beginning of the year, but then we have some web-based things. And then we utilize a lot of webinar opportunities, advancement resources. We offer a lot of those learning opportunities to our team as well, because we want to make sure our skills are continuing to develop, right? Our cultivation skills, not only in those cultivation with those that can bring, that are our prospects and donors, but we're still cultivating relationships with our providers as well. And then we also have a mix of classroom style in-person learning opportunities. Not so much now in our current world, but previously we did. So we do a little more targeted Zoom calls. That's a smaller group, just to be able to take what we plan for in-person and really modify that for virtual. And then lastly, we have created a manual for a model and trainings that help us implement that. So Bruce, could you talk us through a little bit more of your vision for the team and why this was so important to invest in?
Absolutely, Leah. Thank you for the opportunity. So we created the Medstar Philanthropy Academy really to be the overarching methodology through which we would build the culture. And we're not so much concerned about building a culture of philanthropy, but as you referenced earlier, Leah, building a culture of gratitude, knowing that gratitude drives philanthropy. We'll get to a culture of philanthropy when we have a true culture of gratitude built. And a culture of gratitude is not just a philanthropy strategy. It's actually a good health system strategy. It's right for patient experience and family experience and patient and family satisfaction. It's right when you're working to address clinician burnout. And Dr. Matthews will share a little bit more about that. But we believe strongly that we're not unlike all of our colleagues in healthcare philanthropy. There is a very clear and strong stereotype about the work that we do in philanthropy and healthcare. We run events, we send a lot of direct mail, we come into patient rooms and we strong arm them until they write us a check before they're discharged. How many of us have walked down the hall of a hospital and had a physician or another staff member say, hold on to your wallet, hold on to your purse, here comes Bruce, right? That's the perspective that people have. It's unfortunate, but it's in many ways has been all too accurate in our industry. And so moving away from that model really means we build around what we know is the most natural and organic connection for people that want to become philanthropic partners. And that's this notion of gratitude. And it can't just be a philanthropy strategy, but it needs to be at the core of what everyone in the philanthropy operation is about. And I like to talk about the fact that we created the Academy, a great example, so that somebody like my executive assistant, who hosts a lunch at Christmas time, a holiday lunch for all of her colleagues on the executive floor, she can actually at that lunch talk about the work we're doing in philanthropy and talk about the importance of gratitude and the importance of building a culture of gratitude. And her colleagues across the executive assistant ranks in the C-suite now have a much greater appreciation for what we do, and whatever their stereotypical view was of the development or philanthropy department before, I can guarantee you today, they're champions, they're partners, and they influence their executives. And those executives have a much greater sense for what we're doing and why we're doing it, and why the work that we're doing in gratitude and the Philanthropy Academy is core to the important strategies and priorities of the health system.
I think one of the things is, in conversations Bruce and I have had is, Ben mentioned earlier that he calls me the gratitude evangelist, but this is really creating a team of evangelists. And the reason why we do that is to be able to engage with our care providers and our associates and board members, so that we all are evangelists and can champion our model. So when we engage with care providers through the umbrella of the academy, it's again e-learning modules. So we do have something on our actual LMS, like our learning system within Medstar. It's not mandatory, but it is a tool that can be shared, and we do. We do have people share that, and we're able to scrape some data from that. Continuing education credit. So we do offer some things for CME accreditation, especially if we're presenting to something like a Grand Rounds, then we make sure that has some credit behind it. Virtual and in-person education. So one of the ways that we really look at our education and our engagement with care providers in this way is that we meet them where they are. So we all know it's hard to sometimes be able to get on the calendars of our care providers. And instead of creating a separate opportunity, and sometimes that's the right time and place, sometimes that's strategic and makes sense, but we really say, okay, what are you doing with your team? When are your quarterly, monthly meetings? And we come with a 15 to 20-minute presentation that really gets right to the point of talking about, why does gratitude matter? How do you interact with it? How do you accept it and respond in a way that's going to create all those positive experience feelings for the patient and their family? And then how do you work with us, and how do you connect that gratitude to us and the philanthropy team? So that's a big piece. Typically that was a lot of in-person work, and now we are doing that through Zoom or joining WebExes or things like that for the department. Our champion program. So that's something that we have developed as a way, and Bruce had mentioned it, but it's really our way of identifying those that are continuing the conversation of gratitude when we're not there. Those are our great partners that not only are making introductions to us, but are doing things in their department that build a culture of gratitude. So that may be providing thank you notes or gratitude boards, or having a gratitude moment on agendas, things like that. And then culture building tools. So some of the things I just mentioned, where they're willing to kind of embrace this culture of gratitude and do some small things in their department to be able to facilitate that. Dr. Matthews, do you, as your role as a physician chief, and kind of being on the other side of that, do you have things that maybe we should be thinking about as we're engaging with our care providers, or things that we should be aware of before we walk into a room?
Sure do, Leah, and thank you for that. I think you've heard this theme several times now in our presentation, and I'll re-emphasize that we're talking about the entire care continuum. In other words, all of the providers that interact with and help our patients, not just physicians. And it's amazing how much that group of people needs and benefits from training in the gratitude model. They need to learn how to recognize, receive, and respond appropriately to gratitude. I also thought it might be beneficial to the audience to hear from a physician some tips that I think are potentially valuable in interacting and engaging with physicians. The first thing is meet them where they are, and go to them wherever it might be and whatever time. It may be 6 in the morning in their office, it may be 8 at night in the nurse's station, but go to them and respect their time, and take the message to them wherever they will meet you to do so. Provide agendas and clear goals in advance. Physicians like to be structured. Definitely respect their time. They're busy. And if you ask for 10 minutes, don't try to take 20. And I would also say follow up and follow through. And don't just make it a one-shot deal, but make sure you stay connected, stay engaged, and trust me, they will appreciate that.
That's great advice. Thank you. I have watched many sunrises with physicians in a conference room because that was the time we could meet. So how do we look at building culture across our associates? So this extends beyond just those that are providing care, because we all as associates interact with patients and their families, right? So we want everyone to be on the same page. So we have a lot of intranet tools that are internal. We still rely on the in-person and virtual education. We partner with things like orientations. I think one of the biggest things that has shown success for us in building culture, and we have a long way to go, but we have had some wins. And some of that is really evaluating what are the system initiatives. Bruce is fabulous about doing this and having that lens as he's sitting in the executive team meetings, because he can recognize where there's opportunities that maybe we can complement or come alongside of, instead of reinventing the wheel or coming and creating our own process and it being one more thing. A great example of that is what we call IMOC. So that's our inpatient care delivery model. And the goal of IMOC was really to create a multidisciplinary approach between the physician and the nurse, to where they round together and create a care plan and around the patient, and they do that together as a team, and it's meant to really enhance patient communication as well. So we are part of that, so that way during those conversations, during that rounding that's happening, that our associates are able to recognize gratitude in those moments and know how to respond. Sometimes with this scenario is because we are a relatively small team for how many people we have. So there are 30,000 associates across Medstar. There's 46 right now of us in philanthropy. So I know for some teams, 46 sounds like a lot, but when you think about the ratio, that's a lot of people. So we really try to focus on, if we can't have 30,000 people, every single one of them make an introduction to us of someone who would love to participate in philanthropy, that would be great. But we need to make sure first that they understand why gratitude is important and recognize their role in responding to that is part of the patient experience. That is a win, because creating that culture, then the other things with introductions and things like that and creating those champions, then that comes. And lastly, it is on our associate evaluations as well. Is part of one of our, what we call our spirit goals. I know many other hospitals have similar things, to where it's part of our customer service piece and our service of people.
Now I'll just tack on one thing, Leah, that really fits here. And I love that phrase that we're building a culture across the entire system. I think that's one thing that truly stands out of Medstar's intentionality through this process, and is reflected in the results, is that you began with an overall strategy, a message, a way of thinking, in inviting people to shift, but you didn't stop with just the clinicians. You are intentionally working through Medstar associates in a variety of different roles. And what that's doing, what we can see happen over the last several years, is now it's becoming instilled throughout the language and throughout the entire organization in a way that is, to be fair, quite unique to Medstar. You've been extremely effective, and we're fortunate as Advancement Resources to see a variety of different organizations going through the same efforts. And just wanted to applaud and recognize how far the Medstar organization has come to make gratitude part of the conversation at all levels.
Thank you, Ben. I really appreciate that. And you all have been such great partners. And in a minute, we'll talk about kind of how we worked with Advancement Resources when we were developing all of this. But I want to cover our last group of audience first, and that's board members and volunteers. So again, that comes in person. Think of that as an ongoing cultivation with that group. They are so significant in helping us drive strategy and implement strategy and know what's happening. And especially our philanthropy committee members, it's the interface between us and the community and how we can interact with each other. Bruce, would you like to talk a little bit more about how the Academy fits into board members and how we interact with them?
I would welcome that, because I think board members are often overlooked by those of us in healthcare philanthropy as important advocates. We always, in the industry, tend to think of board members as, well, that's people who can give or get. And so we're taking lists of, wealthy people's names to a board meeting or a philanthropy committee meeting and saying, who knows whom, who can make contact with whom. That's not really the power of board members in healthcare philanthropy. In fact, I would challenge my colleagues to undertake a simple exercise. Do a little research about your existing board members. And by research, I mean engage with them and find out what motivated them, what inspired that board member to actually become part of the organization. Why do they volunteer their time as a member of the board? And I would bet you the majority of your board members in your healthcare organization are there because of a gratitude moment. So if you want to talk about real advocates for the gratitude model and the understanding that gratitude matters, why not go to constituents that lived that gratitude, that now chose to express their gratitude, maybe through a philanthropic investment, but maybe also, or instead of, through board service. So board members are natural allies in this build of a culture of gratitude. And not only they're natural allies, and I'll ask Dr. Matthews to comment on this in a minute, but I also know from my own experience that if you deploy a board member to have a conversation with the key clinician about how important it is to understand and recognize someone's gratitude and how important it is for that clinician to partner with the philanthropy team to allow that family to express their gratitude in a meaningful way. When you deploy a board member to have that conversation, it is a lot more credible than the paid chief philanthropy officer sitting with that physician. Not that physicians won't work with us, they will. But you take a volunteer from the community who's had their own gratitude experience, sitting with a physician saying, hey, you know what? I've lived this. It'd be really important for you to make sure other patients and families have the same ability I had to express my gratitude in a meaningful way. And so I'm going to ask you to work with the philanthropy group to make sure those people's gratitude can be facilitated. Let me tell you, that's powerful. That's the real, in my mind, future and innovative way we should be deploying board members as it relates to healthcare philanthropy. And frankly, it's the most important aspect of the work we ask our philanthropy committee members of our boards to do. Be an advocate, be an interface with the clinicians and other providers and caregivers, because how do you say no to a board member? This is a volunteer who's helping to advocate for the institution, and they've lived their own gratitude moment. So Les, I don't know if Dr. Matthews, you want to comment on that, but certainly has been my experience.
No, Bruce, it's been my experience as well. And I think that the power of partnership, I should say, between philanthropy and other volunteers in the organization, like board members, is incredibly powerful to physicians.
That's great. Thank you for that, from both of you. So how did we really get here for developing the Academy? First is we really evaluated where our team was. So like I said, we're spread out between 10 hospitals, and then we do have a central team as well. So we looked at the activity that was happening around and said, who on our team is, and what the ones that are having great success, what are they doing well? And then where do we replicate that, and how do we bring our other team members alongside to be able to implement that, and how do we get them there? Because everybody's in different places, right? Not only just physically, but some of our community hospitals or newer acquisition hospitals, things like that, it takes time. So we had other teams that have been long established with their current group. So what can our newer team members or newer hospital learn from that? So then we went to our team and said, what do you need? Where do you feel like we need to grow? Where are the gaps? Where do you feel like we are lacking? And we really looked at that closely and had very frank conversations. And Ben, I'm sure you remember when we sat down and did all those kind of test groups. So
Yep.
we did, yeah. And do you want to talk a little bit about that and how we work together through that?
Yeah, what I would just describe as phase one of the Philanthropy Academy is really about understanding the needs and then building the framework. And the framework was a beautiful collaboration between you and several team members you tapped into and our design team, right? Just working
Yeah.
back and forth and saying what elements make sense to have be live, what elements make sense that they could be done remote, what elements can be pre-recorded and utilized as an online learning mechanism. And what our was along the way was ultimately to help you build something that was sustainable. We wanted something that could live into the future and be a part of bringing on new team members, new associates at Medstar, new clinician partners, and be that resource that people could tap into. No matter who of the four of us is involved in the future, this resource would be something built for Medstar to have going forward. And using that as our sort of our innovative way of thinking, it allowed us to be pretty flexible on the solutions.
Yeah, that's very well said, Ben. Thank you. So one of the other elements of the Academy as part of our evolution and one of the successes was fulfilling a vision of incorporating physician expertise. So Bruce, could I hand it off to you to talk a little bit about your vision with incorporating a physician into the philanthropy team?
Thank you, Leah. Happy to do this. I've been at Medstar going into my 12th year, and I have long wanted to identify and recruit a star physician to be part of the philanthropy group, and not a physician that would go out necessarily and make traditional fundraising calls, closing gifts, if you will. We don't call them that, by the way, at Medstar. We invite philanthropic partnerships, and people choose to accept, defer, or decline those partnerships. But I've long ago wanted a physician to partner with us in our work, but to partner with us around building the culture of gratitude, not necessarily around the financial aspects of the work that we do. And so it's been my dream for some time. We've talked about it inside the group. I've talked about it with my boss, the CEO, for a number of years. And we just never could find the right person until we got to know Dr. Matthews, which I had the opportunity to do a number of years ago, and get to know him more and more through some work together. And then we had this unique opportunity as Dr. Matthews was stepping away from a leadership role over orthopedics in our Baltimore market to make a pitch. And actually was a fundraising pitch. My pitch to Dr. Matthews was, I'd love you to come in and be part of what we're doing full time, be part of our team in the philanthropy group, but I don't want you to do it based on what I'm telling you we want to do. I want you to do your own research and you determine whether the build of a culture of gratitude would be appropriate for Medstar Health, not just to grow philanthropic partnerships, but to address these big issues around clinician burnout and patient satisfaction. And so I was so pleased that we were able to convince Dr. Matthews. He clearly didn't do research on me very long because he ended up joining my team anyway, but we're thrilled to have him, and I'm going to let him tell you his story. But it really is fulfillment of a dream to have a medical director working with us in our philanthropy group now at Medstar Health.
Well, thank you, Bruce. Bruce said his goal was to recruit a star physician, and he was unsuccessful at that, so he got me instead.
No.
But I thought I would perhaps set the stage by just giving you a little bit of insight into my background. I am an orthopedic surgeon who specialized in sports medicine, and I was department chair at Medstar Union Memorial for almost 30 years and oversaw the residency program there, our fellowship training programs in orthopedics there. And later, as Bruce mentioned, I also took a regional role overseeing orthopedics for Medstar. I wanted to share with the audience what I consider to be a fairly self-deprecating video that was shot, I believe, in 2016. And I'm doing this as a way to highlight not only my own journey to philanthropy, but also to highlight some of the challenges that we all face in engaging physicians. So to set the stage, when this video was shot, I was a very busy physician. I was doing over 500 surgeries a year. As I mentioned, I was running a department, a residency program, fellowship programs. I was also team physician for the Baltimore Ravens and many other colleges and universities. I was busy. And because of that, I think I really didn't have a lot of time or much engagement with philanthropy at that time, and didn't really see where philanthropy fit into not only my own career, but also into the lives of my patients. So let's look at the video and then we'll follow up.
Most of us that refer to specialists do so picking a specialist from a group of specialists because we believe that particular specialist offers something unique, whether it's their skill set, their bedside manner, their affability and availability. All these things go into who you decide you will direct a patient to and who you won't. Okay. Now the difference is that we don't pick our philanthropy folks. They are employed by our health system. Okay, so they are what we have. So we need to be confident that when we send these patients to the philanthropy folks, that they're doing all the things we would want a hand-picked consultant for our patient medically to do. You know, treat them with respect, be available, be professional, be damn good at what you do. If they feel that they've gotten a special experience here, and hopefully they do from an orthopedic standpoint, we want them to have that exact same experience if they have contact with philanthropy.
Thank you, Dr. Matthews, for sharing that video with us and allowing us to share it with the team. You know, I think that's something so many of us interact with, that when we are talking to our physicians that are so busy, sometimes it takes time. You know, I think we always look at our work with our providers the same as we do with our prospects. It's not a one conversation and done type of thing. Instead of cultivating for dollars, we're cultivating for introductions to relationships, and that building that relationships and that credibility takes time. So
it certainly does.
Yeah,
it certainly does. And what I was going to say is that, you know, I said this was a self-deprecating video, and I think I was kind of a jerk, and it came across that way. But you know, I think it's important to emphasize what changed, and what changed for me was simply gratitude. And Bruce approached me just as I was stepping away from my administrative roles and clinical roles, and asked me to participate in blazing a new path as a physician working in philanthropy. And I was frankly a little skeptical, but after being introduced to the gratitude model at Medstar and the way Medstar was approaching philanthropy, I became more intrigued. And then, as Bruce mentioned, I did my own homework with research and interactions with a number of other professionals who convinced me of the power of the gratitude model, not just for philanthropy, as we've said, but also in many other areas where it benefits our providers and our associates and our whole health system. And then I had a very impactful lunch with Alice Ayers, the executive director of AHP, and she was both enthusiastic and encouraging, and continues to be, and I'm appreciative for that. So my role now is that of a champion of gratitude. I try to provide a liaison between our physicians and other providers and our philanthropy team. And I'm very enthusiastic for being an advocate for the culture of gratitude that we strive to achieve. So thank you.
that's wonderful. Thank you so much for sharing all of that with the group. I want to jump in. You know, Dr. Matthews mentioned gratitude was really what changed it. So let's take a minute to focus on why people express gratitude, and then we'll wrap up talking about kind of our contemporary observations. So when someone does something nice for you, it kind of tips the scales, right? You want to do something nice in return in order to find that equilibrium again. And that's a concept we share with our care providers and all of our associates, because all of us share that experience. When someone does something nice for you, you want to return the favor. And our patients and their families feel the same thing. And not only is our patients from that care experience, but our community as well. And where we've seen that shift is actually during this recent time, during the pandemic. So Bruce, would you mind talking us through a little bit more about what we've really seen recently of how that how gratitude has been expressed?
Absolutely. You know, There's nothing good about this pandemic, nothing good about it, except maybe one piece, which is we're finally recognizing as a society what heroes we have in healthcare. And it is our providers, it's our physicians, our nurses, our therapists, our PAs, but it's also the other people on the front line. Just think about people in environmental services and food services and patient registration and security and all those other folks that, frankly, during a pandemic, raced to the front lines to be supportive and helpful to patients and families. And the community has responded in a huge way. And I'm talking about the global community recognizing and expressing their gratitude. All of us in healthcare have experienced it. Food deliveries and flyovers from the military, and one of our community hospitals had a drive-by parade from all the first responders to just say thank you for the work that our healthcare heroes are doing. And so this notion that gratitude matters and that gratitude drives engagement, we know at Medstar, because we validated it through significant growth in philanthropic support, driven mostly by gratitude moments and experiences. We know that beyond the revenue, finally now, out in society and our communities, there's a deep sense of gratitude for our healthcare institutions. More important than the institution, though, and I say this all the time to folks, is the people inside that institution and the exceptional gratitude people are feeling for our healthcare heroes, frontline clinicians and other frontline associates that are doing amazing work. And we certainly saw that during the height of the pandemic earlier this spring. And the community came out in big ways, and they supported us in significant ways. But beyond that support, what they did in significant ways, they also helped us with the relationships we have with our clinicians and our caregivers, because we've been able to use the significant gratitude that was expressed through so many nice gestures from our community, in addition to making philanthropic contributions. We raised over $8 million for COVID relief at Medstar in a 4-month period of time. Beyond that, now our clinicians, our gratitude model is resonating with our clinicians and our caregivers. And this has only advanced our work in the most significant way. So I would never suggest COVID's been good for anybody, but it certainly has highlighted for us in healthcare philanthropy the importance of gratitude, and the community is validating that for us. What's really important, though, I think, to keep in mind, and I have to say this, as a chief philanthropy officer who is responsible and accountable for the bottom line, it's how we're evaluated. Regardless of all this great work that we're doing, it's still about how much we're raising. This team at Medstar did an incredible job during COVID, and we maintained our focus. We pivoted where we needed to pivot, but we also maintained our focus, and we actually were able to close in the midst of the pandemic the single most significant gift we've ever had in our history. And it was for an initiative that we've been working on for some time, and Safe Babies, Safe Moms initiative in Washington, D.C. It was a partnership with the Clark Foundation. It's a wonderful, very generous family foundation in Washington. And not only are they helping us address some very significant health disparities, it couldn't come at a better time, because we've had the chassis at Medstar to be able to have impact. And now through a significant partnership like this, we get to activate that and make that a reality. And so my reminder to us through all of this is gratitude matters. Very important to build a culture of gratitude, but don't miss the opportunities to continue to engage with people, both organizations and individuals, who believe in your mission, who are inspired to and share your passion and inspired to want to make a difference. I said to our team through the pandemic, and they've carried it beyond in a very admirable way, it's time now for us in healthcare philanthropy, as our boards and our clinicians and our senior leaders are working to rebuild the infrastructure of healthcare, which was gutted by COVID, It's time for us in philanthropy to step up and be boldly invitational and invite people in bold ways to partner with us, recognizing that for many people who are grateful, their meaningful engagement with us and their meaningful expressions of gratitude may come in the form of philanthropic partnership. And we need it in healthcare now more than ever.
Very well said. Thank you. So now we're going to move into discussion in the remaining amount of time that we have today. And then you'll be able to find us through the conference materials, but then also here is our contact information for myself and Ben if you have more questions after the session today. So thank you.
Thank you, everyone.
Thank you.
Thank you very much.